And we are back, and this is In the Public Interest. My name is Linda Johnson, and my two wonderful guests this evening are Dr. Charles B. Simone of the Simone Protective Cancer Institute and Karen Green Allen, the president of Sisters Network here in Mercer County. Welcome, both of you back.
Thank you.
And I just want to also point this out. These two are right here in Mercer County. We have a lot of talent here in Mercer County. We have a lot of dedication, and the two of you probably exemplify that more than anybody for your dedication to trying to eradicate that.
As do you.
Hey, we're a fearsome threesome here. Now, during the break, we had a question regarding younger women and breast cancer. Dr. Simone, could you maybe shed some light on that?
If a woman of any age with breast tissue development has a question about her breast tissue, it should be taken seriously, should be examined properly, and there's a specific sequence of examination that the doctor should do, and we have that outlined by pictures in our book called The Truth About Breast Health, Breast Cancer. So the breast should be examined in a very particular way and then assess the risk. Now, a young woman is unlikely to have a breast cancer, but it does happen. So you can't let the age fool you and throw you. You need to examine every breast the same way and look with suspicion when there's an issue.
Which kind of brings me to you, Karen, and why it's important to have a doctor that we trust and that we're concerned about, that's concerned about us, because we don't want a doctor who just sort of poo-poos us. You know, if I think I'm feeling something, or if something's not feeling right, don't dismiss me.
Absolutely. I've talked to so many women who say they think they felt something and their doctor ignored them and didn't follow up. And even in my case, my mother is a 15-year breast cancer survivor, and I started getting mammograms at 35. And I always thank my doctor for even writing the script for me to have mammograms at that age, because a lot of doctors won't even write the prescription. And I think a lot of women have that age 40 ingrained in their mind, and it's somehow there's some shield around you that under 40 you won't get breast cancer. 40 is a guideline. It is not written in stone, and you should have a good relationship with your doctor so your doctor listens to you and follows up with you and takes your concerns seriously. And if that doctor doesn't listen to you, that's not the only doctor. Find another doctor.
Find another doctor, and I can't emphasize that enough. Dr. Simone, one of the other myths that I wanted to talk to you a little bit about, because of your background, is a lot of women believe mammograms can actually prevent breast cancer.
Well, mammograms are simply a detection tool. That's all. They don't prevent anything, and that's the myth, I think, comes from our government, where they list as a preventive tool mammograms. It is simply not. It is simply a detection tool and not prevention. Prevention should be the mainstay of our community, no matter who we are, because we can prevent this cancer. This is a diet hormone-sensitive tumor that we can prevent. Genetics, only about 6 to 8% of all breast cancers are related to genetics. So we have control. It's our diet, it's other things that we expose our bodies to that cause our cancers, but especially breast cancer.
Now, one of the other things that was recently on the internet, because I am an internet fiend, I just like to see what they're putting out there. For those of us that, aren't kind of on the front line, some people read these things and they just go off in left field. Some studies actually show mammograms are worthless. Do you feel they're worthless, Dr. Simone?
They're not worthless, but they are not the protective shield we want them to be, we desire them to be. It's simply a tool for detection. We need to prevent the cancer. We need to start early in life to prevent it. Mammograms should be done, but we shouldn't believe that they're the protection. If it's a negative exam, a negative mammogram, there still could be a cancer lurking inside the breast. 20% of the time, they're false negatives. So we need to make sure that they're done, but we shouldn't rely on them totally. We should change our lifestyle, lose weight, low-fat food, no smoking, no alcohol, etc., to really ensure our lower risk.
And part of that, etc., to me, is also physical activity.
It's the 10-point plan all over again.
Yes, it is. Now, also, what role does genetics play? Is it a very big role?
Tiny role. 6 to 8% of all breast cancers are related to pure genetics. So that means, again, we do have control over this because it's mainly related to diet. 60% of all women's cancers are diet related. So if we get onto a low-fat diet, high-fiber diet, supplement with vitamins and minerals, we have to take supplements, vitamins and minerals, because our diet can't supply enough. If we take a good calcium load, a little aspirin every day, these will help you decrease the risk. We also need to avoid smoke. Whether you smoke yourself or inhale somebody else's smoke, that increases the risk, so we need to avoid it. We know that 2 or 3 glasses of alcohol per week, not a day, will increase the risk of breast cancer by a tune of 250%. So we need to avoid that amount of alcohol. We know that walking will decrease the risk. We know that walking will enhance the immune system. We know that if we can suppress stress, we will also decrease risk. So this lifestyle approach, comprehensive approach, is critical to do, starting early in life and continuing throughout life.
And I know that we always talk about it with the Kids Start program,
That's
that
right.
we've got to start our children out
Early in
doing the
life.
right thing.
Because if we teach them early, we won't have our chronic illnesses that we see.
Now, because this is Breast Cancer Awareness Month, I'm going to turn to Miss Karen Green Allen, because one of the major events that we have coming up, October is, I tell people all the time, this has got to be the craziest time in the world for us.
Yes.
But I'm going to let you talk about it. It's the City of Trenton Breast Cancer Walk and Health Fair. Give us some detail, Karen.
Okay, the City of Trenton Breast Cancer Walk and Health Fair is an outgrowth of a walk that was started several years ago by Tona Buck-Teal, and it was a walk that went through the entire city of Trenton and ended up either at Trenton High School or Trenton City Hall. So Ms. Buck-Teal relocated from Trenton, and last year we took the walk over and decided to have it in beautiful Cadwalder Park, where people can walk the park. It's a safe, secure environment. We used the Ellerslie Museum, which is a lovely facility that embraces us and welcomes us. So we have a lovely place to have the walk and a nice place to have the health fair. And it's we want to encourage fitness. So the walk is not a timed race or a competitive race. It's just a walk. So this should be the starting point for you to continue walking on a regular basis.
Now, what time does everything start, Karen?
Registration is from 9 a.m., 9 to 10. We're going to do a warm-up, and then at 10 o'clock sharp, we will start the walk. We want to make sure that people have time to walk, and then we are going to go into the health fair, and the health fair will be till about 1 o'clock. We have a DJ. It's a party. It's going to be a breast cancer party because we've survived, so we like to have a good time. So we definitely want to come out, and many of you have been impacted by breast cancer. You may know people that have died from this illness. We have a very prominent sister who was with us in the cause, Rhonda Berry, who died earlier this year. So come out and support the cause. So maybe one year it will only be a walk for survivors, and we won't be remembering people that have been lost to this disease.
Now, I know some of the other things, some of the other initiatives, because the Robin New Jersey Seed program and the New Jersey Seed program at the Department of Health and Senior Services is actively involved with the Paint the State Pink campaign. Give us a little background about that, because for those of you that don't know it, we have a Christmas tree over at the food court. Go ahead, Karen.
It's at the food court on 50 East State Street in Capitol Center, and we have cards. They're very lovely, and you write the name of the person that you want to honor, whether they're living or deceased, and it's cost $1, and the $1 is used, all of the money that's raised from the walk and the Paint the State Pink, and we had an earlier event, Paint the Night Pink.
Paint the State Pink kickoff event.
Paint the State Pink kickoff.
At the Marriott.
It was a party.
It was a party.
It was fun. And all that money is going to be used for women who come in with needs from the city of Trenton and may not be able to afford whatever they need related to their treatment, and the money is used to help assist them to access whatever services they need.
So all the money raised here stays here.
Absolutely, 100%, not a single dollar is going for anything other than direct services to women from the city of Trenton who are breast cancer survivors.
Now, Dr. Simone, I got this anonymous note about, can men get breast cancer?
Yes, indeed. About 4,000 a year get breast cancer every year, and the problem with that is they're overlooked, they're ignored. They have a little lump in the breast, and both the patient and the doctor ignore the lump. They need to be investigated. Again, anytime a person comes in with a breast problem, it should be investigated.
Whether male or female.
Doesn't matter.
And I always am adamant about that because my breast cancer was male-related, and I didn't know. Okay, so, Dr. Simone, we also do a program called the Confident Woman Program.
Linda Johnson.
Dr. Simone. On October 27th, we will be at Bethel UHC Church here in Trenton. We're going to be giving clinical breast exams. Dr. Simone, unfortunately, will be out of town, but it's a good thing because he's very proud about his son. Your son's been accepted to give an abstract?
Yes, at the Astro Convention, the radiation oncology, as well as my daughter, actually.
So actually, it's okay. We'll let you go this time. But we have a wonderful person filling in. It's from 11 a.m. to 3 p.m. Please come out. Everyone is welcome. We have a nurse practitioner who will be there. She will be giving a breast health education session. Roz Council and I will be there giving out information. And, everybody, just come out. There's a lot going on in Mercer County.
Terrific.
And in Trenton in particular. You've got the Trenton Breast Cancer Walk, October 20th, starting at 9 a.m. registration. And, of course, at Bethel UAC Church on October 27th, beginning at 11 a.m. I want to thank both of you, Dr. Charles B. Simone from the Simone Protective Cancer Institute.
Thank you, Linda.
And Karen Green Allen, President of Sisters Network here in Mercer, New Jersey.
Thank you, Linda.